Ladies and gentlemen, thank you very much for coming to Vienna. Thank you for allowing me to speak about contemporary concepts in strategic implantology. Before I come to this topic, I want to clarify a few things about what is up to date, about what we are doing, and how this should be seen and in which field we are working. First of all, this is a picture of our facilities in Switzerland. So this is the old clinic which we opened in 1999. Up here, the second building, which was ready approximately 2008, 2009. And recently we have finished this building on the right side, where the final production of the implants is done. This all is run by Dr. Ihde Dental AG in Gommerswald, Switzerland. Sidney Burwell said, half of what you are taught as medical students will in 10 years have been shown to be wrong, and the trouble is none of our teachers will know which half. I'm not so happy about the word wrong, because wrong means that it was always wrong. What he meant to say is that things are outdated, that things should be seen differently after a number of years, and the point that he is making, however, is absolutely true. If you look at this graphics, it shows you the probability of changes in the available knowledge in the medical field. Down here, anatomy. As you see, less than 1% changes in a decade. This means that in anatomy nothing changes, almost nothing changes, and if you would try to pass a dental exam with a textbook of your grandfather, you will without any problem succeed in this exam. Now, looking at physiology and biochemistry, you see that in those fields we have more changes, probably in biochemistry more than in physiology. So today, for example, if my son would go to the dental school, he would be taught a different physiology than I was taught, the same also in biochemistry. Now, as soon as we move on to the real treatment, move on to the patients, we see a lot more changes. First of all, in diagnostics, there can be changes up to 100%, and in the treatment modalities there can also be changes up to 100%. And this is what was meant by the sentence that after 10 years many things should not be taught as they have been taught before. Many things are changing. The next question is, of course, where are they changing? Are they changing in, for example, in Germany or in Russia or in China? Where are these changes taking place first? And does this knowledge spread? We are today in a situation where the internet is moving a lot of information, basically all the information, around the globe very fast, and things that can be developed in one country and things that can, grow fast and catch ground in one country will be known in other countries. In the old times, like say after the Second World War, or before Europe was united, before the internet was there, of course this was impossible. At that time, the universities had a monopoly for knowledge, and many of the universities think until today that they have this monopoly for knowledge. They behave like this, especially in some kind of setback countries. We see always that this type of thought is still present in the brain. Let's look at the way how we learn. So we all start probably in kindergarten and then in school, then we move on to the university. After university, we are getting postgraduate education. Some of us even undergo specialization. Later on, either the university or dental chambers are providing training. This is even a compulsory training in most countries. Besides this, we get product training and we get training for specific technologies. So from kindergarten up to this specific technology, a lot of training is done, a lot of knowledge has to be gathered, and we need all this, of course, to make money. I mean, this is why we do all this, because we have to feed our families, because we have to make money. The question is, this training for specific technology, should this be already connected to the universities, or should this be given outside of the universities? As we all know that the changes in the teaching inside the university takes replace very rarely. So, I mean, if somebody becomes a professor with a 45, he's very likely to teach the same stuff the next 20 years until he becomes pensionist. So these changes are too slow. So definitely this type of training, product training and specific technology training will take place outside of the universities. Maybe it's possible to motivate dental chambers to include this type of training, but very rarely it will be possible to do it at the universities. The universities have a way of protecting them against novelties, against new developments, and what they do, they say, oh, this is not scientifically proven. Now this term scientifically proven, it's a religious term actually, because nobody knows what is really science, what is scientifically proven, especially in the dental field. The amazing story is that they call the institute a dental school, and then they nevertheless claim that they are in a university and they're talking about science. So this all doesn't go together. So in any case, we cannot expect too much help from universities after we are leaving them. I think we can rather expect from them only problems. So what is really the standard? So this is a question regarding this path of education. This is also a question regarding where in the world are we? I mean, what is the standard in Switzerland? What is the standard in Russia? And what is the standard in China? As you may know, I have worked for many years in Switzerland, and the Swiss are, of course, they think that they are the top standard. They are very, very high. But now, after working so many years in other countries, I don't think that this is really true. I think they are very, very well controlled by their chambers and by the universities. I don't think that they are advanced. Now, regarding strategic implantology, of course, this discipline or this method gets criticism. No? Some say that we are breaking the rules. We are breaking the rules of implantology. Is this true? Others say, okay, is this really an improvement or is this really an innovation? Well, my answer is strategic implantology is a substitution. So this technology will substitute the present implantology. I'm quite sure, and in many countries this technology already has reached the tipping point, so there is no way back. I have never seen it that an implantologist who has been learning this technology and who has started to work with this technology, that he ever came back to two-stage implantology. This is simply, it's not happening. I mean, if this would happen, then this guy or this lady simply wouldn't have understood the basics. So strategic implantology is a substitution. So what is a substitution? It's a replacement of an item by a different item of a completely different kind, so often replacing several other goods. The typical example which we learn in the economic school is that the watch, the arm watch, is being replaced by the mobile phone. Even the owners of this mobile phone take into account, I mean, they have to accept it, that if they drop the watch and they take the phone, they have to load their watch every day with electricity. I mean, they have to plug it in. So this is a big disadvantage. You could never sell a watch to anybody which needs to be on the electricity every day. So typically these electronic watches would work forever or for years, but the consumer even accepts those disadvantages. Now, strategic implants are, from the marketing point of view and from the product evaluation point of view, not simply an improvement or an innovation. They are substituting. They are substituting existing products such as two-stage implants. They are substituting other medical devices for bone augmentation. So this implant does both. It replaces the bone augmentation and it replaces other implants, and of course it works in immediate loading and it works with almost no bone. We all know this. So this is a real substitution, and that's also, I mean, companies like Straumann and Nobel Biocare, they understand this problem, because the substitution means that their product or that the old product is going to to disappear. If you compare this to the watch and the mobile phone, now of course the watch manufacturers try to do something against that, that people are suddenly not wearing their watches anymore. But they can do what they want. They can invent a watch which runs triple as fast. People will not buy it anymore because they don't need it. I even, I don't even can think about giving to my son a watch as a present, because he will say, Dad, what I want with this, this is very nice, but give it to grandmother. We're not wearing this nowadays anymore. So some watch manufacturers have understood the problem, and they move to, they move their watches and the design and the price to into the quality direction. They are charging 100 to 300,000 of euros for one watch. So because they did this, the product didn't become cheaper. You would expect it becomes cheaper. It's the opposite. It becomes more expensive. Before we actually now come to implantology, to basal implantology, I want to, there are a lot of young colleagues here who are, recently have opened their office, who are in their 30s probably. I want to say a few words about running a clinic and about the market. Now we are, as a dentist, we are on the market. I mean, times are over where, like in the East Bloc, you were the responsible dentist for this and this rayon in Moscow South. I mean, these times are over. There are a few polyclinics left, but mainly doctors are working in private clinic, and I think it's going to happen like this in the future. It's going to be more and more like this. So this means that the doctors have to take care of the question, who is their customer, who's going to come into their clinic, and this of course has a lot to do with the products a dentist offers and the products which he offers. This means we'll see, is he going to do root canal treatments, is he going to offer perio treatment, or is he going to implantology, and what kind of implantology is he going to offer? So it's a free market, a more or less free market. Probably around the world we have the freest market on average now which we ever had. And it means that every dentist has to think about the question, what am I going to do with my clinic? Where do I want to go to? Where do I want to be in the next, after 5 years or after 10 years? In which direction am I going? Now we know from Jack Welch, who was a very talented economic guy, and he always said that he will invest only in markets where he, with his enterprise, can be the number 1, the number 2, or the number 3 on the market. So he completely excluded the possibility that he would be with his business, further running. So he always wants to be the number 1, 2, 3, because it means there's enough turnover, there's enough income, enough possibilities to further invest, to grow, and so on. And so this might be a little bit strange to you as a dentist. I think that you also should think about this question, how you can reach this position, number 1 or 2 or 3 in the market. Now the question is, what is the market? In general, we think that the market of dentistry, this is the market of all treatments which are done. Everything from the tooth extraction to the denture and so on and so on. But I recommend that you don't think like this. As an implantologist, you might think about the market of implantology. So you could think about the question, okay, I'm positioned in Berlin North, so what is the percentage of implants that in Berlin North are placed, and what is my percentage in this market? But as we are substituting, like I said before, we are substituting this technology, we should rather think about the market of immediate loading. So the immediate loading implantology is a market by itself, and I recommend that you are considering only this market. And with the help of this thought, you will be able to position yourself properly on that market And as this market now opens, of course, the first runners have the best possibility to be the number one. And once they are, or let's say number 1, 2, or 3, and once they are this, they have the best possibility, if they are clever, of course, and if they are constantly working, they have the best possibility to maintain, to stay in this situation. This means, of course, growth. Well, growth means more patients, more chairs, more problems, more implants. So if you intend to be the number 1 or 2 or 3 in the market, you have to be ready to grow. I mean, this has to be agreed with your wife, with your family, with your nurses and so on. So there must be an investment plan, and there must be a plan how to gather the patients, how to satisfy the patients, how to have a big enough lab and so on. So please consider this. That now, as this market opens, all of you have the possibility to be in the local market, the number 1, or number 2, or number 3. At the moment, also due to the internet, of course, the market is a little bit different, or it appears differently to you, because, for example, to my clinic, we have patients from Russia, from Australia, from Vietnam, from America, from all over the world. So, this might be misleading that we think, I'm on the world market. How can I be the number 1 on the world market? No, this is not possible. I mean, if you go this way, of course, you have to invest a lot. And anyway, there will be followers up, so other colleagues will take the local market, and then you are done. Please think about the local market. Make on some map, make a line. This is your market, and there you want to be the number 1, number 2, or number 3. And this will help you to get clarity. What has to be done next? What is the next step to come to the success? This is what I wanted to say before we come to the actual implantology, to the basal implantology.